Settle in and we'll be getting started soon. Hello everyone, welcome to this week's Tong Ren session. I'm Johanna and I'll be tapping for you today. A few things to note before we begin. For those of you who've registered, your submitted conditions have all been included in today's protocol. Also, if it's your first time here, there's nothing that's required of you during the sessions. You don't really need to follow along. You don't have to tap or do anything. Just simply listen and relax. Now, the tapping that you're going to hear is in stereo, so headphones are recommended. During the session, we work through 3 key areas as part of the general protocol: the brain, the sympathetic nervous system, and the parasympathetic nervous system. Then at the end of the session, we'll tap grounding points to support a deep relaxation for you. For those of you who've registered, I've also included specific points based on those conditions that you've submitted. So today's session covers both the general protocol and your individual patterns. I'll tap until a few minutes before the end of the hour. Then after the session, feel free to share your comments and I'll stay on to answer any questions. Also, if you're tapping along with me today, feel free to let everyone know in the comments. Just a quick reminder to say that Tong Ren is a complementary therapy. It's not a substitute for medical care, so please consult your healthcare provider for diagnosis and treatment. And now before we begin, let's just take a moment to settle in. So I invite you to find a comfortable position, feel the support beneath your feet and whatever you're sitting on or lying upon, and let your shoulders soften a bit and your hands rest naturally. And now bring your awareness to your breath. And let's take a deep breath in from the belly. And exhale slowly. And let's do that one more time. Breathe in. And release. And now your conscious mind doesn't need to stay engaged during this session. So if you do find yourself drifting towards sleep, that's absolutely fine. There's nothing that you need to do right now except receive. So we'll begin tapping now. At CV17, in the center of your chest, this point opens up the chest. It supports respiratory function and regulates heart rhythm and circulation throughout the body. It also engages the thymus, the immune gland, just behind the sternum, supporting those working to maintain healthy immune resilience and blood cell production. And moving to stomach 11, at the base of your neck, we open the major vascular channels connecting your brain to the rest of your body. This point is essential for cerebral circulation, oxygenation to the head, and the nerve supply descending to the throat, voice, and digestive organs. It also supports salivary gland function for those working with dryness and contributes to the nerve regulation of the esophagus and the upper digestive tract. And now at stomach 12, we engage the lymphatic channels of the upper chest and support vascular flow where the neck meets the chest. This point assists in clearing the lymph nodes of the upper thorax and contributes to nerve supply to the shoulder and the upper arm. And tapping stomach 9 and 10, we support arterial flow to the brain and the autonomic signals passing through the carotid body. Important for blood pressure balance and cerebral oxygenation. For those working with hormonal and endocrine regulation, the vascular nerve pathways here connect directly to the thyroid and surrounding glandular tissue. And moving to LI 17, on the side of the neck, we engage the nerve and lymphatic pathways running along the neck muscle. This supports immune drainage, cervical nerve communication, and the clearing of inflammatory signals from the upper body. And tapping LI 18, this point supports the cervical nerve plexus, lymphatic drainage, voice and throat nerve supply, and the esophageal nerve pathway. For those working with throat muscle tightness, this is a primary release point. It also supports calming the nervous system's resting state. At SI 16, on the side of the neck, we support nerve signaling through the cervical plexus, contributing to sensation and motor control in the head, neck, and shoulder. It's important for restoring nerve communication and neurological conditions affecting the upper body and supports cognitive clarity through its influence on cerebral circulation. Tapping SI-17 supports lymphatic drainage from the jaw and ear region and assists with nerve function in the facial and glandular pathways. For those working with jaw tension, opening the nerve and lymphatic drainage here is part of the circuit. We now move to the skull near the hairline at GV23, directly engaging the pituitary gland's signaling zone. The pituitary is the master regulator of the endocrine system, governing growth hormone, thyroid stimulation, adrenal output, and reproductive hormone rhythms. This point supports those working with hormonal balance, healthy tissue repair timing, and memory consolidation through its influence on the brain's chemical signaling environment. At GV22 and bladder 6, near the front of the crown, we engage the hypothalamus. This area also supports pituitary signaling and the brain's hormonal communication pathways. Essential for those working with hormonal regulation and endocrine balance. Bladder 6 alongside supports circulation through the frontal scalp and upper sinus pathways. Relevant for those managing environmental sensitivities and neurological reactivity. At GV21, we support the motor and sensory cortex and the association pathways connecting the front and back of the brain. This area supports clearer perception, reduces the mental static that interferes with sustained focus, and contributes to the postural signaling that travels from the brain downward through the spine. And now at GV20, the crown of the head. The central point coordinates communication between all brain regions and is a primary point for autonomic regulation. We stimulate cerebral circulation and calm the overactive nervous system signaling that drives anxiety and hyperarousal. GV20 anchors the full spinal nerve axis from the crown down to the sacrum, supporting those working with spinal alignment and lower body circulation. And moving to GV19 toward the sensory cortex. This area governs how your brain processes incoming sensation and manages comfort signals throughout the body. It's essential for reducing sensitivity and supporting restorative sleep. It assists in down-regulating the nervous system's baseline activation for those working with chronic hyperarousal. Moving to the base of the skull at GV17, the medulla, we regulate the vital centers, managing your heart rate, breathing, and blood pressure. The medulla is the direct connector between the brain and the spinal cord. For those working with cardiovascular rhythm and blood pressure regulation, this point is central to managing the autonomic signals that govern vascular tone throughout the body. At bladder 9, we support cerebellar circulation and the vessels of the posterior skull. For those working with neurological conditions affecting coordination and sensory integration, this area is an important part of the circuit. It also supports deeper sleep by improving blood supply to the brain's sleep regulatory centers and contributes to blood pressure regulation. At gallbladder 19, we support the occipital nerve pathway and circulation to the posterior cortex. This area governs visual processing and contributes to the sensory integration that the whole nervous system depends on for coordinated function. And moving to gallbladder 20. This is one of the most important release points for the entire head and neck. Tension here compresses the vertebral arteries and the cervical nerves. Releasing it improves blood flow to the brain, reduces inflammatory accumulation from environmental sensitivities, and assists in clearing the upper cervical nerve pathways. And now we move to the forehead. On the right side to gallbladder 13, we address emotional regulation, stress response patterns, and the autonomic balance between sympathetic activation and rest. This area is essential for those working with anxiety and hyperarousal. It's a primary point for calming the nervous system's default threat response and restoring a more settled baseline state. And now on the left side, this left frontal region governs memory encoding, linguistic processing, and focused analytical thought. For those working with memory and concentration difficulties, we stimulate the left prefrontal pathway to support clearer recall and more sustained cognitive endurance. And tapping the yin tong point directly between the eyebrows. This point activates the frontal nerve, stimulates pituitary signaling through its proximity to the sphenoid bone, and has a direct calming effect on the sympathetic nervous system. It also supports hormonal regulation, reduces mental restlessness, and is relevant for those working with dry mouth through its influence on the autonomic glandular tone. At Tai Yang, at the temple, we tap to support circulation through the temporal artery, which feeds the eye, temple, and the side of the skull. For those working with neurological sensitivity, the temporal circulation here supports the brain's clearance and filtering functions. And moving to gallbladder 8, above the ear, we address the temporal bone region and the nerves running through it. This point is relevant for those working with facial and neurological symptoms. And now we move to the triple warmers behind the ear. Triple warmer 17 supports the facial nerve and circulation. These points together support skin health and immune balance through the local lymphatic and nerve pathways relevant for skin conditions. They also support the endocrine nerve connections to the pancreas for blood sugar regulation. And tapping the yiming point supports cranial nerve pathways and the calming of the nervous system. It also influences hypothalamic appetite signaling pathways. And moving to gallbladder 12. This is a key release point for the upper neck muscle attachment and influences drainage from both the head and the neck. For those working with sensitivity to environmental agents, clearing the lymph drainage here assists the body in reducing accumulated inflammatory burden through the cervical lymphatic system. And now we move back down the sky window to the Tiangdong point, engaging the vertebral pathway, supporting circulation to the brain and the upper spine. This is a foundational point for maintaining healthy blood flow through the vertebral arteries, important for those working with neurological conditions that depend on clear and consistent spinal cord signal quality. And now we move to the spine, opening up all of the points along the spine from top to bottom. And tapping C1, the atlas vertebra. This point directly governs brain-body communication through its proximity to the brainstem and the vertebral arteries. The nerve roots here serve the head, the scalp, and the autonomic centers that regulate balance and blood pressure. For those working with neurological conditions and prostate and pelvic circulation, C1 is a foundational point. And just below, at C2, its nerve roots serve the eyes, sinuses, forehead, and the pineal and pituitary glands. This is important for sleep regulation, supporting the signaling pathways involved in circadian rhythm. For those working with anxiety, deep sleep difficulties, and memory, C2 is a primary point. At C3, we address the nerves along the eyes, ears, and sinuses. It also contributes to the cervical nerve circuit, supporting sinus drainage and upper respiratory pathways. We engage both sides to support comfortable, clear breathing and sensory function in the head. At C4, serving the cranial nerves, vision, hearing, the mouth, and jaw. It's a primary point for those working with jaw tension, gum health, and dental sensitivity. At C5, the nerve roots extend to the mouth, throat, shoulders, and hands. For those working with voice tension and throat muscle tightness, C5 is a primary point. The muscles governing the larynx receive important nerve supply from this root. And we also address shoulder and upper arm nerve supply here, supporting comfortable arm movement. And now at C6, an important point for thyroid function, skin health, hair quality, and calcium metabolism. These nerve roots serve the thyroid gland directly, along with skin, hair, nails, and the calcium signaling pathways that govern bone quality. At C7, we engage the parathyroid gland and bone mineral regulation, including calcium and phosphorus balance. Healthy parathyroid signaling supports bone density and joint resilience, relevant for those working with bone health and structural strength. And we begin working with this thoracic spine at T1. This is the bone marrow activation point, the primary site where we stimulate stem cell production, blood cell generation, and immune function. For those supporting healthy blood production of red blood cells, white blood cells, and platelets, T1 is the most important point in the protocol. It also contributes to nerve supply reaching the upper chest and arms. And moving down to T2, we engage the thymus, the gland responsible for T cell maturation and immune education. Supporting the thymus here helps the body maintain healthy immune surveillance and balanced immune function. At T3, we engage the lungs, the lymphatic system of the chest, and oxygen exchange at the cellular level. For those working with throat health, T3 supports the lymphatic and respiratory environment surrounding the larynx. And moving to T4, serving the skin, the sweat glands, and the chest capacity for detoxification. For those working with skin conditions, T4 is a primary point. It governs the nerve supply to the skin's immune network, sweat gland regulation, and the peripheral detoxification pathways. And tapping T5 on the right side, we engage the pericardium, the protective sac around the heart. And on the left side, we address the heart directly to support cardiovascular rhythm, cardiac valve function, and emotional balance. For those working with palpitations and cardiovascular rhythm disturbances, we address the heart's bioelectrical environment directly here. And T5 also contributes to the regulation of sleep depth And now at T6, the diaphragm and breathing center. The diaphragm regulates oxygen exchange and assists the venous return to the heart. Strong diaphragmatic signaling supports cardiovascular efficiency and contributes to autonomic balance. Foundational for those working with anxiety and hyperarousal. At T7 on the right side, we target the major abdominal blood vessels and support blood sugar regulation and insulin signaling. This point is also important for those supporting healthy blood function. And on the left, we engage the spleen, the organ responsible for filtering blood cells, storing platelets, and acting as a secondary immune organ. And moving to T8, we engage the pancreas and its digestive enzyme and insulin-producing functions. For those supporting blood sugar balance and pancreatic health, T8 is a primary point. And on the left, we address the esophagus and its nerve supply, supporting smooth passage of food through the esophageal pathway. At T9, on the right, we address the liver, the body's primary detoxification organ and blood purification center. The liver also produces the proteins that support healthy blood clotting and fluid balance. On the left, we engage the stomach and its nerve supply, supporting digestive comfort, appetite regulation, and the smooth movement of food through the upper digestive tract. And moving to T10, the gallbladder reflex. Healthy bile production supports fat digestion, cholesterol regulation, and the absorption of fat-soluble vitamins. We engage this level's contribution to the upper abdominal circulation and the digestive enzyme pathways, supporting overall digestive comfort and efficiency. At T11, the small intestine is where nutrient absorption takes place, including iron, B12, and folate, all essential for healthy red blood cell production. And now at T12, we engage the large intestine, supporting regularity, fluid reabsorption, and the final stages of digestion. The large intestine also houses a significant portion of the immune system and its mucosal lining. So clearing signal here supports both elimination and immune health. And moving down to the lumbar spine at L1, we support the adrenal glands that govern the stress hormone output, including cortisol and adrenaline. L1 is also a primary point for the lower urinary tract and the prostate pathway, supporting those working to maintain healthy urinary function and pelvic organ tone. For those working with hormonal and endocrine balance, we invite the adrenal system toward regulated, sustainable output. At T2, we directly target the kidneys, supporting filtration of metabolic waste, fluid, and mineral balance, blood pressure regulation, as well as the production of the hormone that signals the bone marrow to produce red blood cells. At L3, the reproductive organs and pelvic circulation receive support here. This point directly supports the nerve supply to the prostate and surrounding pelvic structures. It's a primary point for those working with prostate health and urinary comfort. We engage it here to maintain circulation through the lower abdominal organs and support structural balance in the pelvis. At L4 and 5, we address the nerve roots that supply the legs, knees, and lower extremities. For those working with knee discomfort and lower body circulation, restoring clean nerve conduction from L4 and L5 is foundational. And moving down to the sacrum, to S1, 2, and 3. These sacral roots support the hips, pelvic floor, bladder, and pelvic bone integrity. S3 directly governs the prostate and the pelvic organ nerve supply, making this section important for those working with prostate health. We work through the sacrum, systematically activating the full sacral nerve pathway from the upper sacrum downward. And at S4 and S5, the lowest sacral roots, we engage the pudendal nerve and the deepest pelvic floor pathways. This supports elimination, pelvic organ signaling, and the grounding structural base of the entire spine, activating the full spinal axis from the crown through the sacrum to S5, support circulation throughout the spinal column and into the lower extremities. And moving to bladder 54 at At the back of the knees, we support circulation through the vessels behind the knee, releasing tension in the posterior knee capsule. It increases circulation to the kidneys and the lower body, essential for those supporting leg and foot circulation. And now we move to liver 8. The inner end of the knee crease. This governs the tendons and ligaments at the inner knee, the structures that control the knee's stability and movement. And now we return briefly to gallbladder 10, 11, and 12 to activate the vagus nerve. The vagus nerve will now descend through the chest and the abdomen, carrying parasympathetic signals that support every organ system we address in the next section, and moving down the sky window to the kidney meridian. Tapping K27, the highest of the chest kidney points, engaging the lymphatic drainage of the upper thorax, the immune environment of the upper chest, and the nerve connections between the cervical spine and the chest wall. At K26, we address the upper chest nerve and lymphatic pathways, the thyroid circuit as it descends from the neck, and the immune structures of the upper thorax. At K25, we support the lungs and bronchi, heart valve function, and the quality of breathing during rest and sleep. We engage the cardiac nerve supply here and support the heart's rhythm and efficiency. At K22, we support blood sugar regulation and the smooth passage of digestive signals from the thorax to the abdomen. At K21, we engage the nerve and circulatory connections between the lower thorax and the upper abdominal organs, supporting the transition of parasympathetic signals from the chest into the digestive system below. At stomach 21 on the right side, in the upper abdomen, we support the digestive processing of fats and blood sugar, insulin regulation, and the upper digestive tract for those supporting healthy blood balance as well as weight regulation. This point addresses the lower esophagus and the junction where the esophagus meets the stomach. We support relaxed, comfortable passage of food through this digestive pathway. And tapping CV12, central point for upper digestive function, gastric comfort, and the movement of food through the system. And now stomach 25, supporting peristalsis, fluid reabsorption, and regular elimination. Healthy bowel function reduces the metabolic load on the liver and kidneys and supports overall digestive balance. And at CV4, below the navel, we support the urinary and reproductive organs, the pelvic floor, and the lower abdominal circulation. For those supporting prostate health, CV4 is a primary abdominal point, stimulating the urinary pathway and reinforcing the fluid regulation circuit, connecting the bladder, kidneys, and the lower spine. And now we address all of the ouch points, the areas of accumulated tension and blocked signaling that each body is uniquely carrying. These blocked areas open up, restoring smooth signal flow wherever your body needs it most. And we also activate the major lymph nodes, as well as any areas of brown fat. And moving now to the arms, to LI11 and 10, we engage the circulation and nerve pathways serving the elbow, forearm, and hand. These points also directly support nerve supply to the arm and shoulder for those working to restore comfortable arm movement. At triple warmer 5, we support joint comfort in the wrist and elbow, as well as easing the ear and neck tension pathways. At the lung 7 point, we support the cervical and upper thoracic nerve circuit. A complementary point for those working with neck pain and upper shoulder tension. At P6, this point governs cardiac rhythm, reduces nausea, and addresses the anxiety pathways through the cervical nerve plexus. At the heart 7 point, we support emotional stability, reduce restlessness, and directly support restorative sleep. This point helps downregulate the nervous system into deeper rest states where healing and recovery can occur. And tapping the spleen 10, engaging the spleen's blood filtering circuit, supporting healthy blood composition, platelet balance, and immune regulation. And moving to gallbladder 34. This is the primary tendon and ligament support point for the lower body. It governs structural integrity of the knee and supports the nerve supply to the lower leg. And tapping spleen 9, supporting fluid circulation in the knee and the lower leg. Pelvic organ signaling and the body's capacity to manage joint-related fluid balance. At stomach 36, we tap for immune function, metabolic vitality, and digestion. It supports the nerve supply to the digestive system and reinforces the immune signaling that flows from the spine downward. And moving to kidney 3, directly supporting the kidney function, thyroid, and adrenal regulation. This point is also foundational for metabolic vitality. And tapping spleen 6, supporting the spleen, liver, and kidney function simultaneously, balancing hormonal output and endocrine regulation, as well as pancreatic support. And moving to the liver 3 point at the ankle, supporting the liver circulation and detoxification capacity. Promoting smooth sleep onset. And downregulating the inflammatory and autonomic overaction at the root of any neurological reactivity responses. And finally, we come to the kidney 1 point at the sole of the foot, the grounding point that closes all of our sessions. It anchors the bioelectrical signals we've worked through today, downregulates the autonomic nervous system from sympathetic activation toward parasympathetic rest, and leads excess nerve activation downward and out of the system. Now that these points are open, we'll just charge the batteries, starting with the upper dantian, the middle dantian, and the lower dantian. All right. This concludes our weekly Tong Ren session. Thanks to everyone who joined. I really appreciate you for being here, and my apologies for going over by just a little bit. Feel free to leave any of your comments if you'd like. I'll stay on for a few minutes after the live stream to answer any questions you have in the comment section. And just a couple of things to note after the session. Right now you may be feeling some drowsiness, and that's a perfectly normal response. So if you can, spend some time resting, and also be sure to drink plenty of water today. And if you would like to submit your conditions for next week's session, you can do so using the link below. Registration does close when the session gets full or 24 hours before the next one begins. So be sure to sign up early to secure your spot. Thanks again for being here, and I hope to see you again next week.